My name is Marina Cesar. I work as a large animal veterinarian. I've been a veterinarian for 16 years. We're here today to do their vaccines. We'll do an examination. We'll check their weight. We'll check their hair coat, see if they've gotten any, skin problems that they've gotten over the winter, and just make sure they're ready to start working and doing something, competing or riding.
Just put Duncan, yeah.
To be a large animal veterinarian, you have to be, number one, understand the behavior of the animals, to be able to read them, to be comfortable around them, because some of the procedures, some of the things that we do can be very invasive. The other big thing about being a large animal veterinarian is you're working usually in a farm situation, so your environment is different always, and you have to be able to improvise and make each farm suitable to what you're looking to get done that day at the farm.
So I'm doing rabies on the right,
Okay.
and the flu rhino on the left.
Whenever I do a procedure, I always explain to the client what I'm doing, what complications might occur if from the procedure. Example, vaccinations, I'll often tell people that I'm doing this vaccine on the left side, this vaccine on the right side, so that when they call me and tell me that on the right side the horse is swollen up, we know that the rabies vaccine was given on that side. So we can maybe eliminate that vaccine, change the vaccine, just so that we give the animal better care the next time and that doesn't occur.
Write that down. One more sec. Right there.
I don't know if we tranked him.
Whenever I approach mostly horses, I give up my hand so they can smell it, and then I'll often touch them in the shoulder. A lot of animals seem to be calmed by touching them and by rubbing them, especially in the chest area. It's a calming effect, or it might just be a distraction, but it seems to work.
Ah, sleepy horse. Perfect. Just a little bit. Maybe wild.
We're going to start with the feet and then go from there.
You have to be patient foremost with working as a veterinarian. And you just have to be very understanding of what else is going on in their life as opposed to what you're seeing right there, because we all have a lot of things going on in our life, and now they have this emergency, depending if it's an emergency, or this problem sitting in front of them, and they may have some trouble feeling at ease with it. And that, I think, is the veterinarian's job, to explain, educate, and just make the person feel better about what's going on, because it's a problem. And problems can be, when you don't know about it, can be overwhelming. So the first thing I always do is explain to the person, this is the problem, this is how we can fix it, this is the solution that we can look at, and most likely this is what's going to happen. We're at this farm because this horse had a problem with what we call tying up, or a muscle pain that presented a couple of weeks prior. And we did blood work at that time and realized the horse had very high elevated muscle enzymes, which indicated some muscle damage. And so here we are 2 weeks later, and we're just rechecking those levels of blood muscle enzymes to see if they're back to normal, and then the horse can go back into work.
I think his butt fat pads are a little bit better.
Yeah.
His neck is a little less crusty. Actually, I can't.
The weight in this horse was overweight from my observations, and an overweight horse, just like an overweight person or any overweight animal, makes them much more prone to a lot of disease processes. In horses specifically, they get a condition called laminitis, which is inflammation in their feet that can be quite devastating, very painful. This is a fat pad here.
Oh, those aren't the muscles.
No, and he's
He's got a lipoma on his. What are you doing?
I think he definitely hasn't gained weight, and I think maybe he's lost a little bit. And owners tend to have a difficult time appreciating whether an animal is overweight or not. There's certain things that we look for on their body to indicate whether they're obese. And so pointing those things out to owners and explaining it to them so that they can then feed them properly is the goal.
Well, how much is he on?
3 teaspoons.
Yeah. We're gonna go work a little bit. We'll be back.
Bite him.
We're here today to castrate a mini stallion that's about 2-3 years old, and we're going to do that procedure under general anesthesia. We look for a place that's going to be safe. Horses can jump up quickly, they're flight or fight animals, and they can stagger a lot coming out of general anesthesia. So we want an area that's pretty open, no obstacles to get into. Once in a while, I have another associate that's a large animal veterinarian also help me today. It's Karen Kezarowski, and she'll probably be watching more of the general anesthesia. First injection that we give is a sedative. It just gives the horse a little relaxation. We watch that by looking at the horse's head position. His head should come down very low. His lower lip should be very relaxed. Once that's achieved, we then go to another general anesthetic that we give them, IV. These are all IV. And once that's in, within a minute, the horse will then fall to the ground and be under general anesthesia. Working as a large animal veterinarian is very enjoyable, very satisfying. Every day is different, and I love that about the job. I love working outdoors. I love working with people. It's a tough job, I'm not going to deny that, and I will say that. It all balances itself out, and it makes it all worthwhile.